Breast reduction is, I think, it's a very good operation. I think some of my most satisfied patients have been those ladies who have spent a lifetime basically being ruled by a very large bust, and to, if you like, be freed of a large bust can be, I think, enormously liberating to some patients. Obviously, a breast reduction is an operation which is only applicable really to ladies who've got a very large bust, and the sorts of symptoms that people have can be divided into basically the physical symptoms and the psychological symptoms. So from a physical side of that equation, patients complain of constant heaviness. Patients complain of getting soreness underneath the skin because the skin always gets a bit damp. Patients complain of constant backache and neckache. They complain of grooving of the bra straps in their shoulder. And from a psychological perspective, a lot of these ladies have had comments really from when they were in their early teens, when their breast started to grow. Some of them never go swimming because they're concerned about their appearance in swimwear, and as I said, their lives are really ruled by their large bust. And I think for those patients, breast reduction can be a very, very good operation. As with all operations, it comes with the downside is that unfortunately you can only reduce the breast by placing some scars on it. You definitely will leave some scars on the breast. And secondly, you've got to go through the procedure itself. That means the operation, a little bit of pain and discomfort, and the recovery period, and you also expose yourself to some risk of complications. And so the preoperative clinic is very important to discuss those aspects. So if you're going to get the benefit, however, of having a smaller bust, there's a number of things that unfortunately need to happen. Firstly, the operation will definitely put some scars on your breast, and although the scars are designed to be as cosmetic as possible, they go around the areola and then down and underneath, and hopefully will heal up in time with a very minimal scar. There's no way of doing the operation without leaving those scars. Secondly, you've got to go through the actual operation itself, which involves a little bit of discomfort and a recovery period. And thirdly, you do expose yourself to some risks. So as far as the scars are concerned, I usually illustrate that to the patients in the clinic beforehand, and they can see some examples of the scars that of my previous patients. As far as the operation itself is concerned, what happens is you come along, you see me beforehand, I do all the marks that I need in before the operation. You see the anaesthetist, and you then go into theatres. When you wake up, you'll be in a bra. You should be fairly comfortable because we've used lots of local anaesthetic. And you go back to the ward. You usually spend one night with us, and provided everything's fine the next day, you get away home. For that first week, I ask you to take it really easy. At home, you're washing, you're showering, you're wearing your bra all the time, and you're able to lead a normal sedentary life. But I don't want patients doing any housework or doing certainly no exercise or anything excessive. I usually say to people, you can get back, you're comfortable getting back driving around about 3 weeks, and it's going to be about 6 weeks before you get back to the gym. During that period of time, you'll feel a little bit of discomfort in your bust, especially in the first week or so, but usually people are not taking anything stronger than paracetamol and or a little bit of Brufen when they get away home, provided the breasts are remaining well supported and comfortable. After that, after 6 weeks, you crack on with life as if, and you can do anything that you did beforehand. As far as the risk is concerned, again, because we're giving you a general anaesthetic, there's always a small risk of having a problem associated with general anaesthetic. Perhaps the most common, or the one that most I always advise patients about is getting what's called a DVT, stands for deep venous thrombosis, which is a clot that you can get in your leg. It's also been called economy class syndrome from flying economy class to America, and we take precautions against that. It's a risk if you're having a general anaesthetic for whatever reason, if you're having a wisdom tooth out, and we give you flight stockings and we give you things that squeeze your calf during the procedure, and that reduces the risk, but we can't reduce that risk absolutely to zero. Specific to the operation, there's also a small risk of bleeding after the operation. If you get some bleeding after the operation, that might swell up, and that's called a hematoma. If we did that, we'd have to take you back to theatre to wash it out, and that's why we keep you in hospital, just to keep an eye on that. So it's more of a nuisance than a problem, but nevertheless something that can happen on rare occasions. There's always a slight risk of having wound healing problems. Again, you've got usually if you were to have wound healing problems, that varies from a small little crust that we don't worry about that falls off after a week or so, to a little bit more significant wound healing that actually needs to be dressed by the nurse. That latter aspect of things, a wound that actually needs to be dressed by the nurse, thankfully is very rare in my practice, and but nevertheless it's always a possibility. Infection is also a risk with any operation. Infection can vary from a bit of redness that we don't worry about, so some redness that we give you antibiotics to an infection where we actually have to bring you into hospital and maybe do an operation to release an infection that might have built up. Again, getting a significant infection in breast reduction operation is thankfully very rare, but nevertheless there's always that risk. We will definitely create some numbness around some of the scars. There's also a small risk that we'll create some numbness to the nipple itself. If we do create numbness to the nipple itself, it's usually temporary, although it can be permanent. The scars themselves will heal, and quite how the end result of your scars is very much up to your biology. And if you're someone that has good scars, then the scars will be relatively imperceptible over time. If you're someone that creates slightly more obvious scars, then they will obviously always be there. Although there are no scars in the cleavage line, so that the cleavage itself will always be free of scars.